The following audio-supported podcast is intended for informational and educational purposes only and is not intended as medical advice. Please speak with your healthcare professional before making any treatment decisions. The guests on today's show were paid to participate in this podcast.
Hey Thal Pals, it's your fellow patient advocate, NinaMaria again, and I'm here with co-host Dr. Kevin Kuo. You're listening to Thal Pals, the Alpha Beta Revolution. On the last episode, we talked about lab tests, and if you remember, that was part 1 of 2. So we're going to kick back with it and get to part 2. Just like part 1, my co-host, Dr. Kevin Kuo, is back in the hot seat. Kevin, are you ready to get grilled again?
Absolutely. Bring it on.
All right, let's get started.
Agios is a biopharmaceutical company that's fueled by connections with patient communities, healthcare professionals, partners, and each other. Building on these connections and the company's unmatched leadership in PK activation, Agios is pioneering therapies for rare blood disorders, including sickle cell disease, thalassemia, and PK deficiency. To learn more, visit us at agios.com. That's agios.com. To join the conversation with other patient allies, follow us on Instagram at Ally Voices Rising.
So since ferritin is connected to iron, for patients who have periods, can their cycle impact ferritin at all? Or even are there any other outside factors that can impact these numbers?
It's interesting that you mentioned about the periods, because certainly in people who do not have thalassemia, having heavy periods means that they can be iron deficient, and that's reflected in the drop in the ferritin. However, the amount of iron that we get from blood is so much that the period is only a drop in the bucket. So to put things into context, we gain around 1 to 2 milligrams of iron per day. We absorb it through the gut, okay, maximum 2. And then we lose around 1 to 2 milligrams of iron per day through the shedding of the GI tract, the gut lining cells, and through periods for women who are menstruating. In contrast, the amount of iron in each bag of blood is around 200 milligrams. And as many people receive anywhere between 2 to 4 units of blood, for adults at least, 2 to 4 units of blood per month. That would mean that you're getting around 400 to 800 milligrams of iron a month. That, of course, pales in comparison to the amount of iron you're losing every day, the 1 to 2 milligram per day.
What about any other factors? Nutrition, the foods we eat, activity, anything like that have an impact on it?
Yeah, in general, I would say that, physical stress can certainly increase the ferritin. Illnesses can increase ferritin. Inflammation can increase ferritin. In terms of diet, I really don't recommend any one particular diet. I think everybody should eat a balanced diet. That doesn't mean that you need to be going to Capital Grill every night, right, for your big juicy flank steak. And on the other hand, it doesn't mean that you have to turn completely vegan or vegetarian either and avoid iron at all costs. I think, again, if we take things into context, the amount of iron that people absorb through transfusion is so much more than just the iron from regular diet. So I don't recommend going on a particular diet. And then also, I tell people, there's one thing I do advise though, is that I tell people to be very careful when they take nutritional supplements. Often supplements, especially those multivitamins, contain iron. So read the label carefully. It's best that people avoid supplements that have iron in there.
Are there supplements that exclude the iron? And if not, how should we get our vitamins then?
There is. If people are truly wanting to take supplements, absolutely. But majority of people in the world, the diet, I shouldn't say majority of people in the world, majority of people in developed countries, in OECD countries, our diet is so fortified and enriched that it really is not necessary to be on any sort of nutritional supplements. Now, except for vitamin D, okay, that's a totally different kettle of fish. And then, of course, we have to talk about different circumstances, individual patient needs, right? But overall, our diet is so enriched that unless you're a complete vegan, that you will be absorbing enough micronutrients such that multivitamin is really not necessary.
And then, we're talking about ferritin, but also as part of our lab series, how can patients take labs into their own hands, whether it be ferritin, hemoglobin, or any other lab?
Yeah, no, that's a very good question. I think working collaboratively with the doctors to keep track of the screening labs that they need. So this is in addition to the hemoglobin and the ferritin. Remember that we do a lot of labs as well to look at our hormone levels, like vitamin D levels, your fasting sugar, things like your estrogen for ladies and testosterone for males. These are thyroid hormones levels, for example. These are all very important as well. And a lot of times they need to be done on a regular basis. So I think keeping track, working with your nurses, working with your doctors to make sure that those labs are done according to whatever the institution's guidelines. Let's say ours, for example, we do those tests like once a year. So if your institution does that once a year as well, there's no harm in reminding your nurses that, oh, you know what, it's January or April, wherever you guys do it, January again, I need to have my hormones checked again.
Absolutely. Just to reiterate, keep track of yourself. Your doctor's there to help, and they will surely do their best to keep track of your labs and your tests and all of the things. But it's your body and it's your health, and you are just as responsible as your doctor. Do what you have to do. Keep a notebook, a calendar, your notes app in your phone, or if you just have a really good memory. But make sure you make note of when you're doing these things. And like you said, it's not just hemoglobin, ferritin, it's not just iron, it's not just these ones that yes, those are important and we need to keep an extra eye on it, but it's overall health, hormones, and vitamin D in your eyes and your hearing. Like, all of the things are important to keep an eye on.
Exactly. No, well said.
Kevin, tell us a little bit more about why MRIs are important for patients with thalassemia.
So going back to that analogy, right, what we really want to know is the number of kids, right? And so the MRI lets us look into the school directly. Lets us look into the liver school and lets us look into the heart school. And why are we focusing on those two organs? There are other places that also has iron as well. There is a gland called the pituitary gland in our brain that secretes hormones. We can look at iron in the pancreas, right? Which is where if the pancreas doesn't do well, then we can have diabetes. We can do that as well, but mainly we focus on the liver and the heart. And the reason why we focus on those two areas is because majority of the iron goes into the liver first. 70 to 90% of the iron, total body iron, is in the liver. And then second of all is if there's too much iron can also get into the heart, and people don't feel it, okay? There's no nerves around the heart. There's no nerve endings in the heart per se that you can sense the iron. There's nerve endings for other things. When you get a heart attack, you feel it. But when people get iron in the heart, they don't get a heart attack, okay? The heart just gets really stiff because you can imagine your heart is actually turning into like a iron, right? And not only that, the way heart beats is that it conducts electricity, right? It uses electricity to make the heart beat. And so you can imagine that if there's too much iron, it can really screw up the wiring in the heart and it doesn't beat well. So often when there's too much iron in the heart, people don't feel it, but by the time they feel it, things like shortness of breath, chest pain, because the heart starts to grow big, is what we call heart failure. People are at high risk of having these irregular rhythms in the heart and having sudden death. So you really want to be able to detect and treat any iron overload in the heart and the liver as well before it gets too late. Another problem with having iron in the liver is that people can get liver cancer and also a problem called cirrhosis. Cirrhosis is irreversible death of the liver. Unlike other organs, the liver has an amazing capacity to regrow itself. It's almost like that story about salamander where you cut off the tail and then sort of regrow the tail afterward. And the liver, it has a tremendous ability to regrow. But there is a tipping point where the liver cannot regrow anymore, and that's called the cirrhosis. And we like to avoid that. And when people are getting their blood transfusions, the iron eventually will be recycled and add back into the liver. And you can imagine that the liver is like your kitchen sink, okay? I don't know about you, but as a child, I've done this once, and I can't remember if it was because of a prank or whether I did it accidentally, but I just left the water faucet on. I don't know if you ever had that experience.
Oh no, I'm sure your parents weren't very happy about that.
They were not. Yeah, I left it on. I didn't realize it. I came, and then the entire kitchen got flooded. So the reason I gave that analogy is because the liver is like the kitchen sink, okay? And the water is like the iron. When you start loading iron into your body, the iron goes into the liver first. Once the liver fills up, then the iron will start spilling into the other organs, like the hormone producing organs, like your heart. And the way we measure the iron is that iron itself, you can imagine each little iron atom is like a magnet and it has certain pull as a magnet. And the way MRI measures it is that we're actually not measuring the amount of iron, we're actually measuring water, specifically the proton inside water, like subatomic particle. We're actually measuring a subatomic particle called proton inside the water. Our body is made of, 70% water, right? And what happens with this water, with the proton, is that each proton has a spin, okay? It spins in a certain direction. And you can imagine that when a person is in an MRI, essentially it's a big hole, right? It's like you almost enter it almost like a coffin, right? It's like this big donut. The big donut itself is a giant magnet. And a giant magnet is going to alter the spin of the proton. It's going to change the direction of the spin. Okay. If you can imagine that around this water now inside the liver, that there's these iron, person is accumulating a lot of iron, the iron atoms is laying around this water molecule, they start to exert pull, like magnetic pull, because we talked about how the iron atoms themselves act like little magnets. And when it pulls, it changes the direction of spin and changes the speed at which it relaxes when we change the magnetic field in the MRI. And so the speed at which the rate changes, in which the direction of the spin changes, is called the decay rate. And we measure that in milliseconds. So the shorter the decay rate, the more iron there is in the body, or whatever organ you're talking about. Let's say you're measuring the iron in the heart. If your decay rate is really short, then there's lots of iron. If the decay rate is really long, then you don't have a lot of iron. So this is why when we measure the heart, when we use a method called T2 star, we say that if your numbers are low, it's bad. When your numbers are high, it's good. And how low is bad and how high is good. We use 20 as a cutoff. Anything that's below 20 milliseconds, so let's say 15 milliseconds, 10 milliseconds, and so forth, that's bad. That means there's some iron in there. And anything that goes below 10 milliseconds is really bad. And if it's above 20 milliseconds, it means that there's virtually no iron in the heart. Okay, it's normal. Conversely, in the liver, we also measure it in milliseconds, but they change it into a more meaningful and more readable form of a number called liver iron concentration. And the way we express liver iron concentration is the amount of iron per milligram of the tissue of the liver. Because by measuring the amount of iron in the liver, we can also visualize how much of a tissue mass we have in the liver, and then we can calculate the concentration of the iron in the liver that way. In the case of the liver, the higher the number, the worse it is. The lower the number, the better. For example, if your liver concentration is 2 milligram per gram dry weight, that's excellent, right? It means that your iron is really under well control. On the other hand, if it's 30 milligram per gram dry weight, it means that the iron is not under good control.
So what happens next if our MRI numbers are in those red zones, those really low or really high for the liver? What do we do next?
I think it's important to find out the reasons why. First of all, are we getting enough iron chelators? And second of all, when are we taking the iron chelators? Because that, depending on when people take it, or in terms of in relation to their meals, in relation to the time of the day, it can actually affect the iron. And then it's how often we're taking the chelators. That can affect the iron as well. Last but not least is the speed of change, right? If last year you were 2 milligram per gram dry weight, this year you're 4 milligram per gram dry weight, yes, it did increase quite a bit. It looks like it's increased, like it doubled. But, I mean, it's still in a pretty decent range. So the urgency, or I shouldn't say urgency, the severity or the concern is not as great as, say, if your last year's liver iron concentration is 2, this year you jump to 10. Obviously, it's more severe if that's the jump. So we sort of contextualize that way. And then between you, like the person, and the doctor can then figure out what is the most suitable strategy to reduce the iron.
Are these numbers expected to increase as patients get older, or is this something that we could potentially maintain at a very low rate as we get older?
In my clinic, and as in many clinics in the world, we have patients who are aging gracefully with thalassemia, and I can tell you that their iron is under beautiful control, and it's not a concern for them at all.
So how often should we be taking these tests, MRIs, and looking at big picture iron?
Again, thanks to the Thalassemia International Federation, they've given us an excellent guideline in terms of how often to do them. In general, we would do the liver MRI yearly, and for the heart MRI, we'd do it every 2 years. Now, in some special circumstances, and in circumstances where there is actually a lot of iron in either the heart and or the liver, we would be doing them as frequently as, say, every 6 months. Yearly and every 2 years is the general rate.
Other than what you've so gracefully explained, is there anything else that patients should know about MRIs?
Yeah, I think that it's important to, well, first of all, I think people need to know that it's a very accurate tool to assess the amount of iron in the liver and in the heart. Second of all is that the measurement itself, especially the heart one, you're going to notice that the radiologist often give like multiple values. And these values can be somewhat divergent, meaning that you can see in one area there's 20 milliseconds, in an area there's 35 milliseconds. And the reason for that is because the way the iron is deposited in both the heart and the liver, it varies quite a bit. In some areas within the heart and the liver, there could be like a lot of iron. In some areas, there may not be as much iron. In the case of the liver, the radiologist would calculate an average liver iron concentration. In the heart, some would calculate the average, some would provide multiple values to reflect the fact that the distribution of the iron in the heart is really quite variable. And it's important to look at all the values as a whole as opposed to focusing on one particular value, because what this does is that it gives us a holistic view of how much iron there is in these organs.
Well, the more you know.
Awesome.
I think that does it for our series on labs. Thanks everyone for joining us. And if you like what you heard, share it with your friends, share it with your family, share it with the world, and join us next time. See ya!